Hello, my name is Owen Anderson and I'm one of the consultant eye doctors here at Bournemouth Eye Unit. We have a lot of patients going through a similar experience to yourself. I appreciate that you may be anxious before having an injection into your eye. I do hope you find the following video reassuring. The aim is to give you some useful information. I hope it will help you feel less worried. We use injection treatment for certain conditions that affect the back of the eye. In particular, we use it for macular degeneration, retinal vein occlusions, and diabetic macular disease. I can reassure you that it is the best treatment available. It's understandable to be anxious before having an injection. We do everything possible to make it as comfortable for you as possible. Sometimes the eye can be irritated after the injections. This is usually due to the antiseptic we use. However, the antiseptic is brilliant at preventing infection. Therefore, the antiseptic we use is definitely worth having. In the following video, our team will explain various aspects of having an injection. We're also very fortunate to have one of our patients explaining her personal experience.
The prospect of having a needle inserted into your eye is of course very daunting, but then the thought of going blind is also very alarming. So if one is given the chance of stabilising, if not improving the condition, one tends to come to terms with the process quite quickly. The eye is anaesthetised using drops and the whole procedure is very quick. And all one normally feels is some pressure on the eye when the needle actually goes in. It's also reassuring to know that the procedure is carried out by specially trained staff. I personally found that following the procedure, the eyes are very susceptible to light and a pair of dark glasses is helpful. As the anaesthetic wears off, the eye tends to throb a bit, but this will become more comfortable after a few hours, and a couple of paracetamol usually helps.
Hello, my name is Dan and I work in eye outpatients. You might also see me for your scans as well. When you come in for your injection, we will take you through to the waiting area. We will then start your drops.
So I'm just going to start off by giving you a dilation drop. So if you just look up for me. And you can dab that if you need to.
We give the drops plenty of time to work. Don't worry, we make sure you receive enough drops to keep you comfortable during the procedure. Please bear in mind that the injecting clinic can be very busy and there will be a wait for your procedure. We will do our best not to keep you waiting any longer than necessary.
So we'll do your last numbing drop. There we go. And when you go inside, they'll give you, because you're nice and numb, they'll give you another drop when you go in. Make sure you're super duper numbed.
Hello, my name is Feli and I am a specialist macula nurse. Welcome to the injection clinic. We will do everything we can to make you as comfortable as possible during the procedure. If you need a pillow or would prefer not to lie flat, please let us know and we can arrange this for you. We always check your personal details prior to an injection as a precaution and to ensure all our details are correct. We are all specially trained to perform this procedure and we have lots of experience doing it, so try not to worry too much as the procedure is very quick and the numbing drops are very effective. We will give you extra numbing drops in the theater prior to the procedure to ensure that it is as comfortable as possible for you. Keeping as still as possible for the short time needed for the injection is very helpful. We no longer give you antibiotic drops after injection as they are not necessary. However, after the procedure, you can use lubricating eye drops or dry eye drops at home if you wish. If you have any questions at any time during or after the procedure, please feel free to ask.
I've just had my eye done and it's absolutely wonderful. You don't have to worry about anything, no pain. Staff are wonderful, put you really at ease. In fact, you could fall asleep when you're having it done.
Hello, My name's Graham and I work in the eye emergency department. Just so you know, it is normal for the eye to feel gritty or uncomfortable following an injection. This usually lasts for up to 24 hours. The main cause is often the iodine, which we use during the procedure. You may also see black bubbles or blobs in your vision after an injection, and this is normal as well. These are air bubbles, and it's quite usual to see them for up to 3 days following an injection. If the discomfort or pain in the eye does not settle down within a day or two after an injection, please contact us in the eye emergency department for advice. In addition, if your vision is worse after an injection and does not improve within a day or two, you need to contact us. We are here 7 days a week until 6 p.m. and 2 p.m. on Sundays. One last thing, if you have a problem with your eye and are due an injection very soon, please contact us in the eye emergency department for advice. Here are our contact details.
Well, the thought of having injections in my eye was terrible, the thought of it. But the whole procedure they do now in this theatre is so quick and so good, and you feel nothing, really. But the thought of having it done is still there. Oh, I've got to go in for an injection. And that's the worst part of it, is the thought of it. It isn't what they do or that you feel anything, because you don't. Everybody comes out looking as though they've just been to the theatre or something. They all look happy when they walk out, don't they? Have you noticed that? They all look as though nothing has happened. They've had nothing done, because it's not painful, and they make everything so easy for you, you know, and they're so nice when you get in there.
If you have any other questions, by all means do ask our team. We are here to help.